Get ready for more frustration, version 2.0. If you have been able to get into the market, pick a plan. Your next step to complete the transaction is to pay for it. So, is the website ready for that? A top IT official for the Obama administration says that part of the website, well, it's not even built yet. Representative Michele Bachmann joins us. Unbelievable.
Another day, another disaster for the Obama administration. It's absolutely
that can't be true.
No, it's true. And what was amazing at the president's press conference last week, when he said he had 106,000 people who signed up for the health care plan, and he compared it to Amazon. If you went to Amazon and did the shopping cart and you didn't pay for your shopping trip, there's no transaction that occurs. You can't sign up. So it's impossible to say you signed up. And their big problem with this website, which they admit they haven't even built the pay system yet, people have to pay by December 15th so that their policy is paid for January 1st. So there is very little time to get this thing up and going.
How can the website possibly, I mean, now they're talking about an 80% completion by November 30th, which is, you know, they're lowering our expectations. Not at this point do people have high expectations, but, I mean, you've got to be able to pay for something. Aren't the insurance companies absolutely enraged? I mean, they're the ones who want the money.
Well, they're the ones who are going to get the money and the subsidies from the federal government. So that's why the insurance companies are up in arms right now. They're trying to be a little bit under the radar, but they're absolutely up in arms. But they're pushing back hard against the Obama administration. In my state of Minnesota, our governor came out the day before the president's press conference and said the president had to keep his promise, that people had to keep their health insurance plans. But he just came out yesterday, and our governor in Minnesota said no, that we are not going to have the president keep his promise because otherwise the insurance companies won't get paid.
Is he a Democrat or Republican?
He's a Democrat.
All right. See, this is what I don't understand. Is that, and now you say the insurance companies are pushing back. I am suspicious of the insurance companies. I see these numbers going around hundreds of billions of dollars, and we see what goes to the website. And for the life of me, I don't understand, you know, why I need so much money for a failed product, but whatever. But we're going to do a segment in a minute about the insurance companies, how they're doing. I can't understand how they're making off like bandits, because number one, they have guaranteed payment from the government. You know, we talk about subsidy to the consumer.
They're on a sliding fee scale, the insurance companies. So if they don't get enough money, it's written into the bill that the sliding fee, the government will increase their subsidy.
Yeah, and that's the reinsurance.
They're never going to lose.
They're never going to lose. And what we talk
right.
about subsidies to consumers, what we're really talking about is guaranteed payments to the insurance companies.
That's all it is.
It's unbelievable.
And remember the hypocrisy, because the Obama administration was beating up on those dirty insurance companies. They were the bad guys. And now it's a big complicit mess.
All right. Now, why are the insurance companies? Have you figured out the economic advantage? Because some of them are throwing doctors off their networks. What I mean, what do they gain by limiting the number of doctors that are available to the consumers? How can that possibly be a good money thing for the insurance company?
Well, it has to deal with hospitals. Hospitals are trying to thin out some of their doctors, too, because the thing is, they're seeing there's only going to be so much money that comes in. They've got to pay their bills, and everything is predictive. What money they think is going to come in, what the costs are going to be, the whole new level of mandates and requirements. So they're having to unload anything that will be costly.
Here's what one doctor told us, just a suspicion, not a fact, but that the insurance company, let's say they have 25 doctors and they narrow it down to 10 doctors. The 10 doctors will still see the same universe of patients. It just won't be 25 doctors, so there'll be a longer line to see a doctor. So the insurance companies won't have to pay out so quickly. Meanwhile, they'll gain the premiums because it'll be so slow to deliver the service.
And this goes back to, gee, I told you so. This is what we were warning for a couple of years, and it's the fact that you can't have everything, right? You can't add 30 million new people who aren't paying for the service. They're getting subsidies. What's going to happen?
They're not getting subsidies. The insurance companies are getting paid to take care of them.
Insurance companies are getting subsidies, but they're getting subsidized too because they're getting the health insurance.
Well, they're getting access.
So all of us, something's got to get. So it's going to be longer wait times, and it's going to be fewer services.
And of course, we didn't get to it, but sometime about the new deal that apparently looks like the unions are going to get, but we'll talk about that some other time.
Oh, that's coming too.
Yeah, that's coming as well. Anyway, nice to see you.
Good to see you.